life hacks, technology, business, multimedia, wellness and health, events, reviews, and more.
This is Mary Collins with Life Hacks Media and Radio X, and I am back with Dr. Wiechel from Swiss Mountain Clinic. How are you, Dr. Wiechel?
Yes, thank you. I'm well. Thank you so much.
I can see that from what I have read of the weather in your section of town. It's beautiful and sunny as usual up in the mountains.
Oh, yes, it's great. We have so much sunshine here, yes. We work with the most important hormone for our body. This is vitamin D, and we need sunshine.
Well, that's exactly one of the things I wanted to talk to you about, is that right now people want to get out and about. Everyone knows the sun's good for them to a point, so they're all out trying to sunbathe. But what is the other way to get vitamin D in the body, and what are other ways to protect yourself before flu season or even during flu season? What are some of the ways to give your immune system a boost that you can?
The most important thing is vitamin D. So you have not to speak with me about how you can boost your immune system when your vitamin D is low. And we see that the people have here, usually in 1 week, for example, the patient, 75% of my patients have a vitamin D, and this is too low. This is the same, the vitamin D is not a vitamin, this is a hormone.
Okay.
And this is the most important hormone in our body. This is, for example, when you have a house with 1,000 flats and you have only one key. Vitamin D is the key that your immune system can start.
Do you test people to see their levels of vitamin D? Because how does one know that they are lacking enough vitamin D?
Oh yes, we have a small lab machine, and we test the vitamin D with all people. And it's so important for me that I can't start other immune treatments when I have not a good vitamin D level. There are big studies all over the world, thousands of studies, and we know today that low vitamin D and the development to autoimmune disease, development to a tumor disease,
right,
and the development to we know this, the development to a virus reactivation. Yes,
wow.
Viruses live with us. It's not a problem, but when a virus comes in an activation, this is a problem of our immune response. But sometimes it's a problem first of a low vitamin D level. And why it is so important, our liver produces cholesterol. Cholesterol is the most important substance in our body, in the liver. And this vitamin D developed to an active vitamin D, and in this moment the body needs sunshine. And the people have not enough sunshine. In the past they were 6-8 hours outside, but now it's 20 minutes, for example, and the area or the region is not well. When we live here in Middle Europe, all states in the north of Rome has not enough sunshine. And you see the places where people work, they work in big stores, no natural light,
right.
and this is a big problem today. And I see so many people with a low. We have here nanomole per liter. We mean 100 to 170. And in this moment, when you have, yesterday I was a woman, she had 12. And this is the first thing that we know when you have a weak immune response, what is with your vitamin D. And we work with other doses. This is too low, what the people take in the combination with vitamin K2. And this is one thing. And when you have not the possibility that the level increased, there's a big question, what is with your vitamin D receptor?
Oh,
vitamin D has connected with a cell receptor, and when you have not this connection, you can develop to an autoimmune disease. You can develop to a cancer process. And For example, microwaves, my mobile, 5G blocked the vitamin D receptor.
Wow.
Nobody realized this.
Right.
But this is what we know today. And in this moment, slowly, I understand why the people have here so low vitamin D. And sometimes we don't feel this. But for example, this is a war in the Middle Age, and the people have
helmets.
noticed in English,
Yeah.
and they are protect from the head to the feet, and you are neglected. And you mean, no, for me, it's no problem. You are the first.
To be wiped out. Right, exactly.
Yes.
And so is it, people think that they just take vitamin D like tablets. Is that really, I mean, is that enough? Or is it that they really need to actually have some sort of, is it UV light or
in
what?
The combination, we can give shots, for example, 300,000 international units in the first moment, but usually the best is light. Yes, 20 minutes in an AFA costume can be 20 or 10,000 international units, but you can take in tablets, you can take in caps, and in the combination with K2.
Okay. Well, this is something that, of course, people can do now in the summertime, but as we head back into the winter, it is important for people to be seeking out the right kind of treatment to help them, first of all, to find out what their levels are like.
Every people has to know how is my vitamin D in October.
Right.
You cannot start in winter time and you don't know. This is very important. And my experience is that the people need 4,000, 5,000 international units every day. So this is very important. And the other thing is that we, for example, we work with sunshine in winter too.
Right.
Yeah? It's not so much, but every day, and this is enough. And you have to look, how is my level? So, and it can be you need more, or it can be you need not so much, but you have to do a stable vitamin D level.
Once again, people, if you'd like to know more, you can go on to SwissMountainClinic.com and find out about some of the treatments and the importance of getting yourself ready before winter to deal with things that cause our immune systems to break down, like viruses.
Yes.
So thanks again, Dr. Wiechel.
Yes, you're welcome. My pleasure. Bye.
Are you ready for life-saving and life-changing hacks?
Was ist das?
20 minutes of the best top expert tips and hacks to make your life better. Life hacks. Technology, business, multimedia, wellness and health, events, reviews, and more. Life hacks. Every Sunday at 7 p.m. Life hacks. Lifehacks.com. That's with a K and an X on Radio X.